Okay. Okay, anybody see it? If you are on Facebook and it is live streaming, would you please do us a favor and jot down a comment? I believe we are all set to go and it is live streaming now. Okay, great. I want to say thank you very much and welcome Flagler County families, parents, community members, and staff members of Flagler County Schools. We want to welcome you tonight to a panel discussion on the reopening of our schools here in Flagler County. I give you a little bit of an insight into some of the mandates and the DOE mandates that we have to abide by, and give you an opportunity to have some questions answered, and also to hear from our local health department and the good Bob Snyder, who is here this evening to join us. So we're going to do quick introductions around the room, and then we're going to go and dive right into an overview of the plan. So my name is Colleen Conklin. I'm the vice chair of the Flagler County School Board. And with us this evening, we're going to start off with Superintendent Mittelstadt. So Superintendent, would you like to begin? And then we will go around and everybody can introduce themselves.
Fantastic. Thank you for the opportunity to share tonight. My name is Cathy Mittelstadt, and I'm so honored and proud to serve as your superintendent here in Flagler.
Thank you. And Bob.
Yes, hi everyone. My name is Bob Snyder. I'm the administrator of the health department here in Flagler County, and I'm just so pleased to be with you and collaborating with our school district and our superintendent. Thank you.
Thanks again, Bob, for making the time to attend. And Dr. J.
Hi, my name is Earl Johnson. I am the executive director of leadership and operations for Flagler Schools.
Great. Tina?
Good evening. My name is Tina Pisacki, and I am the president of the FESPA, which is the support union.
Excellent. Katie?
Good afternoon. My name is Cathy Hansen, and I am the proud president of the Flagler County Educators Association, as well as a middle school science teacher at Indian Trails Middle School, and the mother of 5 children in Flagler County Public Schools.
Excellent. Thank you. Ryan?
Ryan Deasing. I'm the executive director for technology for the schools.
Excellent. Lynette?
I am Lynette Shott. I am the Executive Director of Student and Community Engagement for Flagler Schools.
Diane?
I'm Diane Dyer, Executive Director of Teaching and Learning.
And David?
David Bossardet. I'm the District Safety Specialist for Flagler Schools.
Excellent, excellent. So we have a full panel for you tonight. Again, we know that everybody is extremely nervous. These are beyond challenging times that we have in front of us. I can guarantee and promise you all of these folks are members of the task force that have been working on our return to school plan and have been working and thinking and eating and breathing all of the questions that we have been faced with. And so tonight we're going to give you an overview, and the hope is that you have a better understanding of the plan and a more of a comfort level, if you will. So with that, Superintendent Mittelstadt, how about if you give us an overview of kind of what the process has been, where we are, and how we got here, if you wouldn't mind.
Yes, thank you. And I'd like to just say on behalf of all of our district leaders, the panelists here this evening that have joined us, this absolutely is unprecedented times that we're working towards setting up a safe environment for our employees to work in and excel in, and of all of our students to have a successful experience this upcoming school year. If I could just take a few minutes and walk us back in time and explain the process that we went through to develop our return to school plan and bring forward information that we have shared already by way of our website. We have a return to school plan page that I encourage all of you to follow. We update that page on our frequently asked questions. So if we don't get to all of the questions tonight that I know that have been submitted, we will capture those and update those often for you. We also have our general guidelines page. And as we need to, we're being responsive to the ever-changing conditions of this virus and tweaking our plan along the way. And so I think it's really important that I first thank our parents and our families for their patience as we work through this. As Dr. Conklin said, this is anxious times, and our job here is to make sure we're standing up an amazing educational opportunities that is so mindful of the working conditions for all of our employees. So today is July 16th, and we have a return to school plan on our website. It has been recently modified. I want to walk you backwards to actually in May. In May, we did a parent and teacher survey that we were looking to learn from the experience of the distance learning that took place to close out the last school year. We wanted to make sure there was lessons learned if we needed to return to a similar platform in the future that we could capitalize on. We also wanted to hear from our teachers and our parents on what didn't work. And there were some of those lessons that we need to be mindful of if we need to utilize a similar platform working towards in the future. Our teams have been hard at work over the summer to kind of refine some of those processes in case we need to do that flip again. After we took that information, June 1st rolled around, and that was honestly my first official day here in Flagler schools. And I immediately hit the ground running, and I asked Dr. Johnson to stand up a task force. And that task force is comprised of many of the people who are participating tonight. The goal of that task force was to explore all of the COVID-19 impacts as it relates to the day-to-day operations of a school district and any instructional impacts that might be needed to be mindful of for our teachers and our staff as we return to school in our brick and mortar campuses. So that task force was organized. It met weekly under Dr. Johnson's direction. And one of the first things they did was they wanted to hear from our parents. And so they launched another survey. And parents, that was when we wanted to hear from you, all of your concerns as we were trying to build a return to school plan and keep all those considerations to our forefront as we planned appropriately. So once we started to get all that information together, we needed to look ahead as August 4th is coming up soon for our teachers, and August 10th is coming up soon for our students. And so the summer is moving along at a rapid pace. We launched our first return to school plan options for learning for students with 2 tracks. One was a traditional model in which our students would go back to school 5 days a week in person, like a typical normal school year, which unfortunately, I think we all realize we're just not going to be there going into 2020, 2021. The second option was for any families who had personal situations that were going on that needed to remain in a virtual platform. And so we have an iFlagler virtual school that we want our families to choose from. Those were our first 2 options. I challenged our school-based leadership teams to work for an entire week and try to make contact with every single family in our county to see which avenue would be the right path for your students to engage in learning next year. In the midst of doing that, our Commissioner of Education came forward with an executive order. And that executive order allowed us to pivot and go with an opportunity to submit a plan that has insurances to protect financially some of the funding sources that we receive from the Department of Education and give our families a third option. That third option we just launched the other day, and that is remote live. And so our families right now need to be reaching out to their schools if they think this is the right path for learning for their students next year. And over the course of this evening, the next few minutes, we're going to transition between the different directors and the different components to helping support this return to school plan. So you'll hear more about those choices in learning from Director Diane Dyer in a few minutes. But the first piece I want to do is have David Bossardet from our safety specialist realm talk us through the different conditions that we are trying to stand up to ensure everyone is safe when we start school this year. So that's my basic overview. I look forward to having the directors participate tonight and share more depth on the explanation. So David, I'm going to hand it off to you.
Thank you, Ms. Mittelstadt. So obviously since last March, we've used the term fluid quite a bit. And I think, you know, every time we think we have a good handle on what we need to keep our students and our staff safe, something changes and trends change. Mr. Snyder's been a tremendous asset to us. We started meeting a while back, right when we formed the task force. And, in our first meeting, he really, I don't want to simplify what he said, but 4 things that he told us to focus on really resonated with me. Number 1 is social distance. Number 2 is wear face coverings. Number 3 is wash your hands. And number 4 is stay home when you're sick. So why I say that is when we started to build our return to school guidelines, we really wanted to focus everything around those things. The CDC came out with excellent recommendations and guidelines, and DOE provided us with recommendations as well. And we really tried to use those recommendations, but put those in a sense of what does that mean for Flagler County and what does that mean for Flagler schools. And what we wanted to make sure is what we put in our guidelines, we need to be able to stand behind and say, if these are what we're saying, we need to make sure we're able to do that. It is an evolving document. It's something that we're looking at on a daily basis as new information comes out through recommendations with Mr. Snyder and everybody in Flagler County. So just to touch on a few things of those to clarify, social distance. Obviously, everybody's heard social distance is 6 feet of space. So what we determined is obviously there's a lot of places on a school campus or on school-based transportation where social distance is very difficult to achieve. It's sometimes nearly impossible on a school bus. So what we want to do is if we cannot get to that 6 foot of distance, what can we get to? Is it 5 foot? Is it 4 foot? And make sure we're keeping as much space as possible in between all individuals. If you can't get to that space, that's where the cloth face coverings come into play. And Mr. Snyder, he reminds us daily that we need to encourage everybody to wear face coverings. And that's what we initially did in our first set of guidelines that we released, is it was strongly encouraged. Looking at the trends in Florida and even in Flagler County, as well as looking at the resolutions that were passed in Palm Coast and the city of Bunnell last week, it made us take a second look at our procedures. Had in-depth conversations with a lot of people, both internally and externally, on where we need to go. So we did modify those on the 14th. What we did is we required face coverings at all places, on buses, on campuses, whenever social distancing is not feasible. So if you cannot maintain that 6 foot space, it is going to be a requirement that all individuals on our campus wear a face covering. That is for grades 3 and up. For grades pre-K through 2nd, we realize there's challenges with getting younger students to wear face coverings, wear them correctly. So we are leaving that as strongly encouraged. But grades 3 through up, it will be required anytime social distancing is not possible. In terms of staying home when you're sick, we will be looking at our response plan, and we are in the process of finalizing that. Again, I need to give a big thank you to the health department, because they are extremely valuable in that. And Mr. Snyder, I'm sure, will speak to what that looks like when there is a confirmed case and how we do react, because they really take the lead, and we try to work and support them as much as possible. But make sure we have a process in place to where if individuals are getting sick on our campus, they are getting the treatment they need and they are able to stay home until they're healthy and ready to come back. And then make sure we're promoting regular hand washing. Make sure we're giving our students and our staff time to wash their hands, especially in between, before and after meals, rather, for breakfast and for lunch and throughout the day. Obviously, as we're doing educational activities and collaborating in class, we need to make sure we're washing our hands afterwards. So that's really the basis of, I don't want to simplify our guidelines because there's a lot that goes into it, but that's what we really tried to focus on. How we help with social distancing is we're in the process, I should say, of eliminating all non-essential items in our classrooms, in our schools, to help get as much space as possible in between students and teachers. In terms of our cafeteria, that is a very populated area. So we have extended outdoor eating areas on all of our campuses, and we're getting creative with other alternative areas or common areas that students can utilize to eat lunches on campus. So that's basically the general guidelines of what we have so far. I would like to encourage everybody to continue to check flaglerschools.com with updates, and we will be sure to announce updates as they become available.
Thank you, David. Perfect. And I know the other portion of this plan is very much so focused on the instructional aspects. So with that, Diane, would you mind giving us an overview?
Yes. So Superintendent Mittelstadt referred to 3 different options: the traditional model, the virtual model, and our new remote model. So I'd just like to tell you a little bit about each to distinguish between them. So we all know what traditional model is. Our virtual model is using our iFlagler Virtual School, which is a franchise of Florida Virtual School. For that model, students need to be independent learners. They will be working on their classes approximately 3 to 5 hours for each class a week. There is a pacing guide, so students within that pacing guide have choices about how much they work each day, as long as they get the work done by the end of 7 days. Attendance is taken weekly. And as long as students are moving forward, they will be successful in the class. They interact with their teachers by email, by phone, with Zoom sessions, by text messaging. So that's the iFlagler virtual model. The new remote model that we have is different than that. So we're differentiating with our terminology as well. We feel that's very important. So the remote model will be exactly like what is happening in the traditional classroom, as far as it's the same curriculum, the same assignments, the same breaks, the same activities, the same reading assignments, the same assessments. Everything is exactly the same. Students will log in every single day using Zoom. They will log in every single day. They'll be able to follow along with their classwork with the teacher. One of the requirements that the state has given us is that the students must be actively engaged every single day. They must be logged in every single day, and they must be able to contact their teachers when they need help. And so that takes a commitment from the parents to make sure that the students are actually logging on, they're following their regular schedule. So we have 3 very distinct models to choose from.
Okay, great. I appreciate that. And I know people have a lot of questions, and once we get into the Q&A portion, we'll take a deeper dive.
Okay.
Okay, excellent. Operations, Dr. Johnson, could you give us an overview?
Sure, I will do that. One of the things when we look at the food services, as Mr. Bossardet mentioned earlier, that is an area which sometimes is difficult to practice social distancing. So we've gone around to each schools and we looked at opportunities for outside lunch areas for each of our schools. So we're going to have outside lunch areas to minimize the number of students who will be in the cafeteria. And our custodial service program, what we're doing is we are going to be proactive with a lot of things that we're doing in terms of disinfecting. We have our 360 Clorox machine that we will utilize each week in all our schools. We purchased 7 additional Clorox machines that we're going to have one for each school, and we're going to be able to disinfect each school. And our goal is to disinfect each school each week. It takes 3 to 5 days to disinfect each school. FPC and Matanzas being the larger campuses, it might take more like 5 days. Our day custodial staff will constantly go in and disinfect our gang restrooms, and they will work on the touch points in our schools to continuously disinfect those areas throughout the school day. Our transportation, what we're looking at is we're going to add additional bus routes so we can minimize the number of students that we are going to have on our buses. So we're going to increase the buses, and so we can decrease the number of students that we're going to have on our buses. Students are going to be required to wear masks on our buses. And we're going to follow the same guidelines that we are following in our schools when social distancing is not available or feasible. They will be required to wear a face mask on the bus or some type of face coverings. Bus drivers will have the boxes of face masks on a bus if a student does not have their face mask. And when we are looking at, from plant services standpoint, we are, and I think it's called MERV, and it's the filters that we're using for our AC units. We used to use MERV, and don't ask me what the acronyms, I can't remember what they stand for, but it's the filtration of the air. But we used to use MERV 8 air filters in our schools. We're going to move up to MERV 11. And also they're working on our HVAC units in our schools so we can have more of the outside air coming into our schools. And am I missing one? Custodial services, food services, transportation, plant services. And am I missing one?
Paraprofessionals, but I'm sure that's not really operations, but we'll probably get to that in the next one.
Right. So I think I hit everything. So one of the things, and I would just say this, you know, working close with the health department and David and our the directors on our operational side, we are trying to do everything that we can to ensure that our faculty, staff, and students who are coming to our facilities and on our buses, they are going to be as safe as we possibly can make it for them. And that is our first and foremost direction that we're trying to move into or what we're doing.
Excellent. Thank you very much for that, Dr. Johnson. And next, Lynette Shott. I know parents, especially of our ESE population, are interested to hear. So maybe if you could provide to us those support services and give a little bit of a background.
Certainly. Our team works on providing support services for our students, our family, and our community as well. And it's probably important to understand what kind of makes up our team. So we have included in our team social workers that are hired by the district. We have mental health counselors. Our nurses are a huge part of our team. And we are a district who made that commitment many years ago and have maintained that to have either a registered nurse or a licensed practical nurse in each of our clinics, and that's not always the case. So we're very lucky to kind of start out on that level. One of the areas that our team has been working on are those medical responses as we return to school with all of the new challenges that surround us as a community, as a world. With COVID. So we actually, several things we've done, we brought our nurses back early and they have been working with us. They were here 2 hours yesterday, we're 3 hours tomorrow, working on enhanced protocols that need to be in place prior to our students returning. And some of those, one of the areas we're working on are our students with significant medical needs that have care plans on file. Realizing that there are going to be additional pieces that we need to build into those care plans that we might not have had in there before. So they're working with me on developing those protocols and what they look like, and then we'll be reaching out to families prior to school starting so that we can get those care plans in place with what would have been our traditional supports for those students, as well as anything that needed to be addressed outside of the norm, such as how we are going to handle where there's more students in an area, like at lunch, or you know, transitioning in the hallways. You know, how do we provide, you know, the safest environment during that time with the least amount of students around them? So we've been working on that heavily. Also on the enhanced procedures within our clinics. Those enhanced procedures that would be the precautionary procedures as far as how we are, you know, maintaining distancing. We all know if we've been to the doctor recently, you sit in your car and wait for them to text you to come in. We won't be putting the kids in cars, texting them to come in, but we will need to be providing areas where when students are waiting, that it's in a very social distanced place. If we have symptomatic students, we are setting up areas, additional areas for each clinic that will provide a separate area until that student can be assessed, and then you know, possibly have to go home at that point. We are actually putting some extra personnel into our clinics that may have only had one nurse and didn't have a school health assistant in there, so that we have additional supervision for this time, these situations where we're going to have some additional areas being utilized for spacing, as well as working with our symptomatic students. Our Department of Health Nurse Liaison, Stephanie Ear, works incredibly closely with us. We can't thank the health department enough for assigning her to us. And so she's very active with our nurses all the time. She does our training every year. She's in our clinics on a regular basis, works with us on overseeing our care plans. And she has been a huge part of working with us on determining these protocols, as well as establishing our response plan, so that when we are working with a student who's symptomatic or an adult, she is immediately, as we develop this and are developing it, bringing her into the fold for that consultation piece, and working with us to determine what next steps are. Because once we get into that point where there's someone who's symptomatic or has received a diagnosis, it is a handoff to the Department of Health. And so she's heavily involved with that. The other part of our world is also our social emotional supports for our students and our families. And I'm going to reference back to the survey that Superintendent Mittelstadt spoke of that we did in May, when we had ended our first, what I like to call the longest spring break in history. One of the questions was, do you know how to access social emotional supports for a student or your child? And 80% of our teachers and staff said yes. 70% of our parents said yes. Well, we want that to be 100%. So I'm going to use this as a shameless plug right now to reach out to all of those that are watching and ask them to also help us make sure we get that out. If we have a student that is in need of some social emotional supports, our guidance counselors are typically our first entry into our support plan. So you can always reach out to your guidance counselors, but if you are unsure or unable to connect with them, you can call my office, the Student and Community Engagement Office. We will immediately begin to work with you to work you through the huge continuum of supports that we have for our social emotional needs of our students. And we have a team of social workers that we have 4 social workers that our district has committed to keeping on hand. And that actually was our largest number of referrals for type of referral during our remote experience in the spring. And we are here to help families that are maybe hitting some difficulties as they are working through as a family with the pandemic. For our students with exceptionalities, our families, we are very excited that our new director of ESC came on board today and has joined us, and has, before she even was officially on board, been pretty deeply involved with looking as we plan to this. But IEPs drive everything with our students with disabilities. As families choose which option they are moving into, we already are working with, if you're going into option 2 with our virtual setting with iFlagler, all of those IEPs will be reviewed, and we'll be working with families on how best to meet those accommodations and needs. We were able to keep our services going virtually through a lot of supports. And so we will definitely be fleshing out those plans, but all supports that your child receives, we will make sure that we are have our team on it. They're already, they come back on Monday, all of our staffing specialists and psychologists, and we'll be hitting the ground running, reviewing all of those.
Excellent. Thank you for that. I appreciate it. And I do want to put another plug in. A lot of people, don't realize if your child is struggling with the social isolation, if you will, in many ways, we do the social services and the counseling services that we have. Folks are doing that like telehealth. So, please reach out to your child's school, contact the guidance counselor. And if you need services, we are here to try to connect you to those services. Okay, I am going to try to be a stickler for time. So with that said, it's about 6:30. We're going to wrap up. We've got Ryan, Katie, and Tina, and then we're going to get to Bob. My hope is that we can start our Q&A somewhere around 6:40. So I'm just putting that out there for the rest of our panelists. So Ryan, your area, very, very fortunate. I want to just kind of give a shout out to the taxpayers in Flagler County, because we were able to flip the switch when this had to happen. I know we had some issues on the west side with folks getting internet, but for the most part, our kids had the tools they needed to make the transition. And that would never, ever, ever have happened if it wasn't for the half-penny sales tax. So I just want to say thank you. Sometimes I think we forget how really fortunate we are in Flagler County compared to other districts. So with that, Ryan, if you would give us a little bit of an overview on your part.
Well, thank you. I will be as quick as possible. But definitely thank you to the community for supporting that half-penny sales tax. I'm part of a Central Florida task force of CIOs, and we've had conversations every week. And I have to say, Flagler, we are in an amazing position to be able to support these options that have been afforded to us from the Department of Education. So the big questions, I think, that have been coming my way, or my team's way, has really been about what does devices look like, what do the grades look like, and then which lane, whether I'm in traditional, remote, or iFlagler, what does that look like moving forward? So to get that out there, we're looking at our traditional and our remote, similar to what Diane has said, to really mirror each other for what those devices are. And it's going to be basically the same as what you parents have experienced in the past. So we're looking at that K-8 is going to be the iPads. There is a little bit of a difference there because this year we already had those plans in place to transition our middle schools into iPads. The difference really is that for our middle school, those folks will have additional keyboards that are integrated with those iPad systems. So they've got the smart keyboard to kind of give some additional options for those middle schools. For our high schools, for the same for our traditional remote, those kids are still with MacBooks. So similar to what they've been in the past. The other point I wanted to kind of point out, or the other piece to point out, is in our kids or students participating in iFlagler option, whether it's K-12, those students will have be issued a MacBook. So that's the kind of, I guess, kind of one of the things that kind of delineates what we're talking about for which lane that you're in. And that's where those devices are going to be, you're going to see that are a little bit different. And this really, the MacBook for that iFlagler really align with what those programs are set up and how those have been run previously. Students that we've got for K, 4 through 12, you'll have like the Zoom EDU, which our families, our students are used to using. It's what we used previous school year when we went in our lockdown, or as Lynette said, our extended spring break. And Schoology, which is the district LMS system. The shift that we're working on currently right now is for our primary grades K-3. So when we talked about a lot of the surveys that came back from our teachers and parents, that was one of the things that really came up, was what that LMS and the support that they got. And so that was the shift now for that K-3 to that new learning management system, which is Seesaw. I think the other big thing that parents, families, and students will see is our shift in deployment. And we saw this on our extended spring break, where we went to kind of a mobile scenario where we're basically doing car lineups, going through distributing machines, returning them when we did our pickups. So that's the model. I think we've done a good job kind of working through that as a team. And we've really revised and cleaned up those processes to really reduce the amount of time that parents are going to spend sitting in those lines. We've modified our system so that when we hand those devices, where in the past, if you've gone to some of our deployments, you're getting the device, we click and check it out to you. You go to a room, you sit down with one of our technology support specialists. They kind of get you logged in, set up. We're doing all of that lifting on our own in the background. So we've got those already in place. When we hand those devices out to parents, whether they're getting a laptop or an iPad, they're already going to be logged in with all of those software and programs set up and ready to go. So you're going to go through those lines clean, quick, and easy. Okay. The other point I wanted to really touch on, and it kind of goes along with the shift as far as that support, we're going into a remote first support. So what that means is utilizing our call center, our help desk, and we're standing those up and making some changes to those to really be able to support students, families, and teachers.
Okay.
And so support will then in person, we'll be doing those scheduled. And I think that's about all I got, Colleen.
And I know we're going to get into more details when we hit the questions. So thank you very much. Katie.
Good afternoon. Again, I am the president of Flagler County Educators Association. I would like to start by thanking you, Dr. Conklin, for inviting me to participate in this panel this evening, and also to extend a thank you to Superintendent Mittelstadt for her inclusiveness throughout this process, throughout this summer. I have served on the Return to School Task Force on behalf of FCEA, and I continue to advocate on behalf of the teachers of Flagler County. We did enter into negotiations with the district earlier this week on Tuesday. We passed a 9-page proposal across the table in reference to all of these issues and concerns that teachers across our district are voicing to ensure that we do have a reopening plan for schools that is as safe as possible for our students and for our teachers. We will be returning to the bargaining table next Friday, the 24th, to continue those conversations, as well as ongoing conversations, because as a few of you have mentioned, this is a very fluid situation. It is an unprecedented situation. We are in waters we don't know and have never been before. We don't have all the answers, but I do appreciate the collaborative nature of being able to work through these issues together.
Thanks, Katie. I really appreciate that more than you possibly could know. Tina.
Good evening. I wanted to thank Colleen for allowing me to be on here. I have, as you know, I'm the president of the support union, and I've also been on the task force, the Return to School Task Force, and it's been a very nice learning event for me. This is new to me. So I just wanted to thank you. As Katie said, they went to negotiations earlier in the week. We will be going to negotiations tomorrow to put across our offer to our proposal to the district as well. So that's about all I have. Oh, and I'm also the bookkeeper for food service. So I've been in the district about 26 years now. So thank you again.
Thank you, Tina. Really appreciate both you and Katie, and for the public who may be watching, and for our staff to know. I know that both Katie and Tina are advocating for everyone's best interest, as are everyone that's been on the panel this evening. But I do want to make sure that the community understands that there will be certain questions that we will not be able to get into tonight because of that reason. And when we get to those questions, we'll make sure to let you know that that's why we can't be as specific as maybe we want to be, because we're still working and ironing out some of those details. Okay, next, we could not do some of the things that we're doing without the involvement of the Flagler County Health Department. Bob Snyder, you have been everywhere, and we're very grateful that you are taking your time to participate tonight. And so if you wouldn't mind, if you could give us kind of a local update. I want to make sure that the community understands that when we hear large numbers of cases, that while that is very, very frightening, we are looking specifically in working with you on what our local data is trying to tell us. And we understand that that changes every single day. And so if you could give us a local perspective, that would be great.
Would be glad to, Colleen. Thank you. You know, everyone, the school district is the Departments of Health's largest community partner, and that wonderful partnership and collaboration is just exemplified in our involvement with the task force. So thank you, Earl, Cathy, Colleen, and David very much, and Lynette as well. We enjoy working with your team. So, you know, the surge began in the state of Florida probably about 6 weeks ago, and it began here 4 weeks ago. You know, don't want to mince words here, but I would say the situation is dire statewide. I know that you all watch the national news and that you're aware of that. Here locally, I feel like the last 4 weeks we've gotten clobbered by the community spread of the virus. We track 10 indicators, and several of them just have gone in the wrong direction over the last 4 weeks. So let me touch upon just a few of them. So let's start with total cases. Total cases today, right now, stands at 575, and that was only 214 just 4 weeks ago. The positivity rate, the last 14 days for Flagler County, is 6.4%. And that compares to less than 1% 4 weeks ago. Hospitalizations related to COVID-19 has definitely jumped significantly. Hospital room, emergency room visits for COVID-19-like illnesses have increased and have been on an upward trend since the week of June 14th, and we don't see a stop to that. Deaths related to COVID in our community stayed at 5 for a good 2.5 months. And just this week alone, we've seen 3 more deaths, unfortunately, related to the virus. And the last indicator, the workload of our public health department staff of nurses and disease investigators, contact tracers, the whole team, our workload has tripled in the last 3 to 4 weeks. And as a result, to keep up and to stay on top of the response, we are adding up to 40 people, full-time staff. And so far we've added about 16. So we're on our way to doing that. So that just gives you a little sense for what the data and what the reality is here in Flagler County. And same thing is being experienced in all the counties throughout the state. In closing, Colleen, I just want to share some reminders for our parents. First, regarding facial coverings, they will be required, as David mentioned, in places where social distancing just cannot occur, like in corridors, hallways, as we're transitioning from classroom to classroom. So that's where it's very important, Mom and Dad, to make sure that our children and students have facial coverings. And that could be a cloth mask, a bandana, a buff, a scarf, just anything to completely cover the nose and the mouth. Of course, our health department, emergency management will work with David and everyone to make sure that there's enough masks available for anyone that needs one. Reminder number 2, please keep your child home if sick, especially if the child is experiencing flu-like or COVID-like 19-like symptoms. And then thirdly, upon a positive case in a school or classroom or an outbreak, the Department of Health team of public health nurses who are disease investigators and contact tracers, we're going to be partnering through Stephanie Ears with Lynette and her team, and we'll be providing guidance as prescribed by the Department of Health and CDC. We are very experienced in doing this, and we do it very well. And again, each positive case, as we think ahead, each positive case is going to be different as to how many students, teachers, and close contacts that should be quarantined or tested. So that's the key. What is a close contact? The close contact is someone who has been within 6 feet of a positive case for more than 15 minutes. So that could be a lot of people, but again, it's different for each case. So that being said, though, we will definitely err on the side of caution. So thank you, Colleen.
Okay, thank you so very much. That's great. I know, again, we're going to get into some of the questions we've been hearing repeatedly. Really appreciate you being a partner in all of this. And local data is going to be what is driving the decision making here locally, which is why you will see, we've all joked about it, but the word of the year, for this year is going to be fluidity. Things are just going to change on a regular basis. So we're going to go ahead right now at this point in time, and we're going to jump into questions. I want to let the audience know at this moment that we know that you have been putting questions in the chat bar, those that have registered for the Zoom program. We are collecting those questions. If we don't get to them tonight, we are going to be collecting all of them, and we will update them on the website and get back to you. So be sure to watch the website's Q&A page for an update and additional information if we don't get to your question this evening. So please feel free to continue to put those questions in there, and we'll continue to collect them. So the first question tonight is, and the questions I've gathered, they are questions that have been sent to me. They have been asked on my page. So these are questions directly coming from parents and community members. First question, does school-based teachers in third option mean students will be taught by their teachers, the same teachers that at the same time will be teaching face-to-face in the classroom. And Diane, I believe we're going to have you tackle this one.
This is the burning question. Unfortunately, we're unable to answer it right now because we don't know how many students are going to be taking that remote option. And so that's why we've put a registration limit of July 20th on everyone, so that by July 20th, we will be able to figure out how many teachers will be.
Diane, you just slipped into mute.
Because I was talking with my hands and I hit my keyboard. I'll move it back. So by July, I don't know where I was, but by July 20th, that we put in that July 20th date because we need to know where everyone is going to be. We don't know if teachers will be teaching remotely, traditionally, virtually, until we know the numbers.
Great. And I think last night we talked a little bit about that is the idea, the concept, but that each of the schools are working too on how best this will look for their school.
That's correct.
Okay. All right, great. And we'll get into, there's a couple of more that might flesh that out even more. Here's the next question. If students have to be present in class during remote learning, is it possible to do so using Zoom? So at the same time, teachers see them and students observe the classroom, participate in discussions and ask questions. And I believe Diane, you'll help us with this one. And Ryan, I think that's what you were referring to alongside with the learning management system of Seesaw. So Diane, you want to touch on that?
Yes, we will be using Zoom just for that reason, so that just like we're using it tonight, people will be able to participate, students will be able to see their teachers, and there'll be two-way communication. Students will be able to receive help from their teachers through Zoom.
Excellent. Ryan, did you want to add anything to that?
No, I think that covers it. My really only point was it's additional options for our primary grades for those K-3 students was really a response or really heard loud and clear from our teachers.
Okay, great. Thank you. Cathy, I believe this one might be for you. Will option 3 be first semester and second semester available?
So at this time, the executive order just outlines fall semester 2020 only. That could be subject to change, and if it does, we'll be ready to pivot and communicate accordingly.
Okay, fluid, right? Fluid. What courses will not be available in middle school? Will Spanish 1, for example, be available?
So I'll take that. So we think the question is referring to iFlagler, or we're not sure. So I'll answer it from an iFlagler point of view. So for iFlagler, we use the middle school courses and all of our courses from Florida Virtual School. We currently have a limited number of middle school courses because we've had a limited number of middle school students. But as our population grows and we have more middle school students, we'll be able to add many more courses. And so Spanish 1 is definitely one of them. Again, it goes back to, it depends on how many students that we have. So as soon as you make those choices, we'll be able to move forward.
Okay, so that's important for parents to know that maybe the choices that they're looking at, they feel limited. What they need to understand is there are going to be a variety of course options possibly that will open up.
Absolutely.
Okay, that's great. Ryan, will video cameras be installed in each of the classrooms and a good sound system provided?
So we're looking at that as part of our remote option for those classrooms. So we've got a team that's been working through this. We're mocking up some classrooms with the help of some of our principals at the schools, kind of looking what that is. But essentially where we're at and what we're picturing is a webcam type of scenario that's on a light tripod with about a 25-foot cable that will be able to connect in with the teachers' laptops that they got. It'll integrate with Zoom, so that gives them additional options. So if you can think of a kind of a camera set about 10 feet off from where your teacher is, whether they're at the whiteboard or at a projector or a display, giving options for where that teacher can be within their classroom. It really comes down to giving the teachers the options and control of those camera and the audio in those rooms. But definitely we're looking at some audio pieces that that will also be able to tie into that as well to make sure that when a teacher is speaking, that the students will be able to hear her appropriately.
Okay, excellent. This is another question, Lynette. I'm going to throw this one to you. Will consideration be given to relaxing the attendance policy? That question's come up a few times.
Yeah, and we have procedures in place for typical attendance pieces. You get parent notes. If you so many that's no questions asked, you have a parent note. You have those students that outside of COVID that have had to have extended absences due to perhaps a surgery or something along those lines. We get a doctor's note and we can medically excuse those. What our conversation is and what we realize is we may have situations where a student has been and the health department has determined that a student needs to quarantine either due to a positive diagnosis or an exposure that they consider needing a quarantine piece, which is a new piece for this. So what we'll be able to do, because our process is so tied to the health department, we will know when a student has been ordered to quarantine due to either one of those pieces. And so what we'll be able to do to kind of help our families out is we will be able to determine those are medically, medical pieces that need to be entered in our Skyward system without asking a parent to go get a medical note. If the Department of Health has determined and ordered them to quarantine, they're in direct communication with us through Stephanie Ear. We do that through our nurses, and then we'll be able to communicate to our attendance clerks, and that would become a medical excuse. So that's where we'll be able to support our families in the attendance piece. And then that is when that is an order by the Department of Health to do so.
Okay, great. Because basically the answer is yes. Parents will have a little bit of we'll have some flexibility, yes. Right?
I can never answer a question with one word. So
we're kindred spirits. I'm right there with you. So no, that was perfect. Okay, next one. My daughter is to attend I3 at FPC, and I'm told she has to go to school. Is this true? Same question for IB, and I've also gotten that question for Dreams at Wadsworth. So basically, if we wrap that question around any specialty programs, right? Specific specialty programs, can those options be done through remote learning?
That is one of the things that the principals are working out now. We don't have any set answers until, again, we know how many students are taking those options, but the principals are aware that there are some programs that will not translate well to a remote option. And so they're considering everything in their planning.
And would it be fair to say that's the goal?
The goal to have them
be able to offer some of those specialty programs as a remote option?
If it's possible, and if it's a program that lends itself to being offered remotely, maybe they're mixed, it's a mixed group. Maybe it's we don't know. We just don't know. There's fluid, remember fluid.
But so one of the programs we were talking about that might be a bit of a challenge is like culinary.
Yes.
Right. And I think it's important to note, and a lot of people have been talking about IB and the ACE program, that we really have no control over the format of their program. And they, at this point in time, do not have an online program, but the hope is we may be able to work a third option out for people to still continue to participate. And that's what they're working out on the schools.
Correct.
Okay, gotcha. Okay, this one has come up quite a bit. Superintendent Mittelstadt, I'm going to throw this one to you. And is there an option to start school virtually and revisit opening schools in October? Or have we talked about maybe completely pushing the start date back a few weeks? And there's been a few others, to maybe everybody go virtual for 9 weeks in the beginning and then kind of phase in a return to school. So some of your thoughts around that specific question, if you don't mind.
Certainly. I think you're hearing across the state of Florida, this conversation starting to become more prevalent. And what I would say would be, we would have an open conversation with all of our board members to discuss both the pros and cons of doing this. There's a lot of complexities behind the scenes when you go to change the school calendar that has both instructional impacts, personnel impacts. And so that would be a very bigger discussion that definitely, I believe, is on the near future.
Okay, great. So the answer to that is stay tuned, folks. All right, here's one that we've been hearing repeatedly, and it's amazing how divided the subject of masks has made everybody. It's kind of mind-blowing in a way. But here's the question. We are, the statement in question, we're dealing with a virus with more than a 99% survival rate, and now we are suddenly requiring our children to wear masks. What exactly led to this decision? Did you consult any pediatricians or doctors? Did you look at statistics and data, or are we just going by fear? And so I think David was going to take a run at this, and then maybe Bob, if you can weigh in, because what I want to make sure to reassure our community and our parents is that we're really relying on medical experts, and we're relying on that data. So David, you want to take a crack at this one?
Yeah, I'd like to start it, and then I would like Mr. Snyder to speak to the statistics and kind of the rationale behind the face covering, as well as the benefits to it. But to answer the question is no, this is not something we did out of fear. This is something we did, through collaboration and through recommendation of DOH and local officials. Our Office of Emergency Management. Again, we looked at the cases, not only at the state level, but even the increase in Flagler County. Mr. Snyder said it, in about a month's time, we increased over 200 cases. So, every decision we make, we're very deliberate with those decisions. We do, and Ms. Mittelstadt reminds us every day that we have to create an environment that's safe for our students and staff. So we realize there is a lot of controversy around it. It is something we took very seriously. We didn't take lightly, and we leaned on those medical professionals and the recommendations they gave us. And I would like Mr. Snyder to speak to kind of the rationale and the data behind the face coverings.
Great, thanks, David. Bob?
Yeah, sure, Colleen. Thank you, David. Yeah, so we do have to learn from what other countries have experienced, in particular Asian countries during the SARS-1 outbreak years ago, this COVID-19 outbreak, European countries, and they were early adopters of mask wearing, and it really did really decrease the widespread in the community of the virus, the community spread. And the science, the evidence, and the studies that have been done based on the experience of these other countries before us, several of them do point out the effectiveness of facial coverings when it comes to the COVID-19 virus. For the main reason is because 40 to 70% of the individuals with the virus are asymptomatic, no symptoms at all. So that's one of the main reasons that drove us, in this direction. The White House now, the governor, all of the county, our three cities, the three cities that have mandated facial coverings. I mean, it certainly does appear that everyone, especially all public health officials that I know of, and all the major medical societies, I mean, they all are supporting the absolute requirement to get adopted to wearing facial coverings to reduce the spread of this virus. That, in addition with other measures, the social distancing, the community testing, the case investigation and contact tracing. These are things that are must-dos to decrease the spread and to put a brake on this thing.
Yeah. So it's very interesting, and I can understand kind of how this happened, because the news, even the CDC or the World Health Organization, 1 minute it's wear a mask, the next minute it's don't wear a mask, and then it's wear a mask. No, don't wear, no, wear a mask. So these mixed messages create some kind of angst, but I want to make sure that it's very, very clear to the community and to the public that in congested areas, for example, the school bus, the hallways, in highly trafficked areas, students are expected to wear a mask, because at this point in time, we don't know what we're dealing with. We hope our numbers are going to be, we're going to be able to drive some of those numbers down for students who are attending on campus, so that in the classroom, the spacing allows for that 6 feet. But we really are, if you don't want your child to wear a mask at all, and you are 100% against, wearing a mask in the hallways or on the bus or in those trafficked areas, we would really strongly encourage you to consider the other options, because we need to be somewhat consistent in this across the board. And to help with that, oh, I'm sorry, was that Cathy?
Can I just make one more comment, if I can, about masks?
Absolutely.
Thank you. This is more about just protecting ourselves. And I'm sure everyone has heard this by now, but the mask wearing is truly more about protecting the people that we care and love, our family, our neighbors, our parents, our grandparents, because we are reducing the chance of them getting the virus. And this is a virus that does kill. And it's very, very serious and very contagious. Thank you, Colleen.
You're welcome. And again, or the hope is that students are not sitting in a mask in their classroom all day long, and that the numbers are small enough that they're spaced out. But to help with that, I know that I think Lynette is going to share, or David is going to share, we are prepared to provide some masks to our students and our families. And so Lynette, you want to share about the good work the Ed Foundation is doing, and then David, maybe share how we're going to be able to have masks available.
Yeah, our Education Foundation, under their executive director, Joe Rizzo, have long been huge supporters of our school district and are very attentive to what our needs are. They've been huge supporters of our Classroom to Careers flagship, and they have built this incredible web of community members and community organizations who are eager to help our families, our students, and our school district as much as possible. So they have taken on an initiative to provide PPEs, masks, to all of our students, all of our staff, and are in the process of making that happen, and are reaching out to the very generous donors here in Flagler County to help kind of support that initiative. And I've seen some masks, that some of the mock-ups of them, and they're adorable because they're very personalized to their schools. But that is just one initiative that's occurring, and I think it just speaks volumes to the support of our community and how they run to us and wrap their arms around us when we're in need for things like this. So we really are appreciative of that initiative. And then I know David's going to speak a little bit more to additional sources.
Excellent.
Yeah, absolutely. I'd be remiss if I didn't thank Mr. Snyder and the Health Department, as well as the Office of Emergency Management, because once they came to us and made this recommendation, and we began considering it, obviously, supply was a concern. Number one, can we even find a place to purchase this? Because when we started discussing it, they were in very limited supply. But Mr. Snyder and Jonathan Lord and his team have been great. We have a very good supply to start off the year, and they've assured us, when we do begin to run low, they will work with us and make every effort to continue to provide us those masks. So we're very comfortable heading into the school year with the supply of masks we have for our students.
Okay, excellent. So let's dive into some scenarios. Parents and staff are concerned, what happens when a teacher or a student is COVID positive? Can you help kind of walk us through, are they quarantined for 2 to 3 weeks? Are they out on sick leave? Is the absence excused? Who clears them to come back? So could we talk about that process just a little bit? And I believe Bob and Dr. J, you were going to deal with this question. And David, I think you can chime in as well.
Well, I will start out in regards to the leave aspect. As Katie mentioned, that we went to the table on Tuesday, and a proposal was put on the table as it relates to leave provision. So at this time, we can't go into details about that. However, I would like for you to know that we will be in compliance with federal guidelines and very sensitive and compassionate to our faculty and staff as we work through this process with both of our bargaining units. And I'll turn it over to you, Dave.
Thanks,
Yeah,
Dr. J.
And then in regards for actually what happens, to that student or staff member, like I mentioned earlier, we are in the process of finalizing our response plan. That response plan does rely heavily on DOE taking the lead as far as identifying those individuals, doing the contact tracing, as well as working with those individuals who have tested positive to give them, guidance on isolation and medical treatment. So if Mr. Snyder doesn't mind, I'll have him kind of explain what that process is as far as isolation for a COVID case.
Okay, so thank you, David and Earl. So let's say that there is a student who has the symptoms for COVID-19 or is a confirmed case. The student would be requested by our case investigators and our team to quarantine for 14 days. And then our public health nurses, trained disease investigators, they would work with our partners in the school system, teachers and staff, to help identify how many individuals were considered to be close contacts. Again, that means exposure to that positive case where they were within 6 feet of that individual for 15 minutes or more. So again, every case is different. In our investigations here, we have some cases where there are 2 or 3 contacts. I can recall a situation where there were 50. So it ended up resulting in 50 individuals staying home for 14 days because they were probable cases and they were close contacts. Some of them needed to get tested themselves. So it truly does depend on the situation and how many people have been exposed. But yes, someone who is a positive case or someone who is a strong probable case, especially someone with symptoms, needs to stay home for 14 days. And with respect to return to school, we would use the non-test strategy. And that is the 3 and 10 rule. That means that someone has been fever-free for 3 days without using any fever reduction medications. And it has been 10 days since the first onset of a symptom. 10 days would have to pass. So then that individual teacher or student would be allowed to return back to class.
Excellent. Thanks, Bob. And who clears the student or the teacher?
That would be through consultation with Lynette's team, Stephanie Ear, who Lynette mentioned, her team, our school health nurses, but primarily our RN disease investigators would be the ones making that determination together.
Okay, and the next question I have, I think I kind of know the answer to, but it's, does every one of those, let's say we have a positive case in a classroom, is every single one of those students and the teacher required to get a test? And if they are, who pays for it? Will somebody else pay for it?
Well, that might be more of a question for Lynette or David, but I can, from a public health perspective, again, it depends on who the close contacts are. It depends on who has symptoms. And many of the individuals who, of course, are very close contacts, probable cases, we do recommend that they get tested.
Okay, great. Thank you. I don't know if anybody else wants to add anything to that. I'm going to go on to the next question. Yeah, okay. We've seen this in the press that this has been mentioned in a few different places. Will parents be asked to sign a release of liability waiver to have students on site? And if so, can parents know that before the decision deadline? And David, I believe you were going to respond for that one.
Yeah, so no, we would not require any of our parents of our students or any staff members to sign any type of release waiver to attend school. We may look at some of those things in extracurricular events, but no, there would be no requirement to attend or work on campus.
Okay, great. Another exposure question. What if someone who lives in the same house as a teacher tests positive, or student, right? Could be a student, tests positive. Does that teacher need to take 14 days off of work, or that student take 14 days off of school? Is that time covered, paid, etc.? And Dr. J, you and Katie want to touch on that a little bit, and then Bob maybe?
I think the same answer is probably very similar to the one that Dr. Johnson gave. A lot of these things are pieces that we are in the process of negotiating and determining through that process.
Okay. So again, and Bob, do you have anything you want to offer? It's probably going to go back to, again, that contact tracing.
Yes, and a little bit more, Colleen, in that a good portion of our transmitted cases are passed amongst household members. That just completely makes sense, right? And so I'm thinking of someone who called me last night, whose son came down positive with coronavirus, and it ended up being where the entire family is now isolating for 14 days. That's just the right thing to do to make sure that we're keeping everyone else safe also and healthy. So that would be a typical scenario, yes. Okay,
great. And this question comes up again and again. Substitute teachers, if somebody gets sick, who pays for the test? For parents, who pays for the test? I want to make sure it's very clear so we're not sending any mixed messages. The school district is not paying for any tests, COVID tests. Am I correct? At this time, right? That we're aware of. Is the health department, Bob, do you guys pay for any of the COVID tests?
All the community testing, Colleen, that's being done right now in the community at Daytona State College, that will move to Cattleman's Hall on the 27th of July, and 5 other sites. And every single test we do here at the health department, that is for free. There is no charge whatsoever. With respect to teachers or to other individuals who get their tests done elsewhere, like a doctor's office, a hospital, one of the Centra Care facilities, an urgent care center, I do not know for sure if they are charging, but I'm sure that they are just charging insurance.
Okay, and I know we don't have a solution, but I did see this question come up repeatedly. And I know it's a source of frustration for the task force, but I want to make sure that the community is aware we're trying to work on a solution. And that is the turnaround time for the test results, that we're aware that it takes so long. And we're exploring possible solutions, but that is still a work in progress. Is that correct?
Yes, and I can address that too. So the volume for testing, everyone, is so significant. There's about 500 labs in the state of Florida that are right now testing, who are supposed to all electronically report both positive and negative test results to the State Department of Health and our Merlin data system. The only lab that I know of that is keeping the turnaround times within 48 hours right now are the 3 public health labs. But they're small. They are not huge labs like Quest, LabCorp, etc. So the reality of the situation is, for various reasons, mainly the volume, it does take right now 8 to 10 days for us to get test results back from many of these major labs. The Department of Health is looking for new labs all the time. And so we have a lab called MDL that is recently came on board. Their turnaround for test results are much better than, let's say, Quest and LabCorp at the moment. So that's the lab that we're going to be using starting July 27th for all of the community testing now in Flagler County. We'll be using that lab. So hopefully the test result turnaround time will be lessened.
And like I shared with David and Bob, you and a few others, you know, my mom is in the hospital. When she first arrived in the hospital, she was tested for COVID. And that was about 1:30, 2 o'clock. And we got her test results back by 6. So there's a way, you know, I hope this is something we continue to explore, because it's kind of a key piece in trying to get those test results back quicker.
Yeah,
Will the
and I-
antibody results that are fairly quick provide enough information as well?
Colleen, one thing is, like, all the major hospital systems and universities, they have the testing equipment that provides that quick turnaround, like within 20 minutes to 2 hours. And so that's needed in the hospital for patients, especially the critical patients. So any central care facility, they also have such a test with the quick turnaround. But the week, because this by appointment only, so there's like a week-long delay in even getting in there to get a lab specimen taken by our urgent care center. So there are some health departments, the larger ones down in South Florida, that have this quick turnaround of test result device. It's a point of care testing device, but they're far and few between. We hope to get to a point where even our health department and all of us have such equipment.
Excellent. Thanks, Bob. Katie?
Yes, I just would like to interject. In some conversations that I was having with the members of the insurance committee, it is my understanding that for employees who have health insurance coverage through the school district, that Aetna does cover their COVID tests. So if there was a cost associated, the insurance does in fact cover that for employees.
That's great. And I know most of the insurance companies do. I hope that the turnaround time is something we can continue to discuss and explore. Panel, community members, the hope was to stick to about 7:15, and we've gone just a little over. So we're going to switch to kind of wrapping it up at this moment in time. I see in the Q&A that we have 104 questions. We will do our best. A lot of them are duplicative. We'll do our best to go through them, have them vetted and answered to the best of our ability. Again, I want to kind of remind everybody, fluid. This is an ever-changing situation. Is there anything before we get to final comments, which I'm going to ask Superintendent Mittelstadt, and then I'll wrap it up. But for the panelists, are there anything, any final comments you want to share with the community, or something that we missed in our discussion this evening you feel is important for them to be aware of?
Well, Colleen, I'd like to share, Flagler County, we are in this thing together. This truly is an unprecedented event. This has not happened to the world in 102 years. Every country on the planet except Antarctica and the Arctic is impacted, or someone who lives on an isolated island somewhere. So we can get through this. It's just that we have to come together to just continue to adopt behaviors that will help, reduce the spread of this horrible virus. It's very contagious. It does kill, and we want to avoid that. And especially the senior citizens in our community are most vulnerable. The health department, we got it nailed down. The community testing, we're working on the case investigation, working on the contact tracing, but all of us need to do our part. And so thank you so much for considering that. And again, appreciate this opportunity, Colleen. Thank you very much.
Thanks again for joining us tonight. Superintendent Mittelstadt.
Yes, appreciate it. I'd like to do a quick wrap up. Thank you, Bob, for sharing that information and everyone's perspective tonight from my leadership team and Katie and Tina. Your membership says, I know you're standing up and being their voice along with all of our other employees. We've got 1,800 employees that work for Flagler County Schools. I have got to ensure their safety and well-being so we can stand up the mission of the school district, and that's to educate every single one of our students to the best of our ability. So as you can see tonight, there's a big lift in making all of that possible. Absolutely, there's some teamwork. We continue to monitor changes on a daily basis and reach out to our partnerships as we continue to revise our return to school plan and make adjustments along the way. Parents, please by July 20th. Make sure you've contacted your school. If we don't hear from you about one of those choices, we're going to keep you in our traditional enrollment. So we'll be prepared for you to return to the brick and mortar opportunity in the traditional model. Finally, I just think it's really important that we just appreciative of the information that we're able to share tonight and the questions that have come in. Colleen is going to push those over to the district office team. We're going to stand those up. We're going to push them back out through our website, which is where you can continue to visit our updates and collect all the frequently asked questions and be very mindful of your concerns out there and continue to communicate to the best of our abilities. I have emails, I have phone calls, I have parents stopping me in the grocery store. That's fine. I'm here for you. We have a lot to do. We want to ensure a great educational opportunity for all the kids, and it's going to take a lot of work to get there while we're protecting our employees. So thank you for tonight's event. Appreciate those who've joined us through this virtual experience.
Thank you, Superintendent Mittelstadt. I want to say thank you to the whole panel and to Bob from the health department. I think both of you kind of nailed it. We need to get through this as a community, and we need to get through it together. When I first started thinking about the governor's executive order and the mandate from the commissioner about 5 days a week, I'm sure like many of you was scratching my head, how are we going to do this? And I think if we begin to look at this a little bit differently and look at maintaining those spaces for students and families who must return to work, those students and families that must have a student attend because they didn't do well with virtual learning, or our special needs population, if you're able to continue to virtually or remotely continue your child's education, that decreases the numbers that are on campus. There is no doubt we'll get through all of this together. Please be patient with us. There is no one on this team, no one in this district that does not want everybody to be safe. And we will do everything that we can to make sure that we are safe. Thank you again for joining us tonight. We'll do our best to answer your questions, and take care. Thanks again, guys. Bye-bye.